Good afternoon. On behalf of our team at RDIEC, we would like to welcome Dr. Drew Kranick and Kelsey, a dental assistant from the Regina Lakeview Dental Center. They are here this afternoon to discuss the type of work they do, the training they receive, the characteristics they are looking for in a candidate, the career opportunities, salary expectations, and the working conditions. We are so excited that you are with us this afternoon. I know this is a very hot topic among students. If any student would like to ask questions at the end of this presentation, that will be open to do so, especially for those that are applying into the dental program of any sort. Just a reminder to all students that after you're done watching this presentation, we would like you to complete a survey that's found on our website. You can either click on it by using the QR code, or you can go to www.rdiec.ca. By completing this survey, you are automatically entered to win a $50 gift card, which will be drawn for at the end of the month. Again, thanks to the Lakeview Dental Clinic. We're going to let you begin, and I'm going to take my face off of here. Thanks so much.
Good afternoon, everyone. My name is Drew Kranick. I'm one of the dentists here at Regina Lakeview, and this is Kelsey Butts, who's one of the dental assistants here in the office. We're going to walk you through, I guess, a few discussions on careers in dentistry. If anyone has any questions anytime, you just feel free to use the chat screen, or we'll get to them then, or we'll get to them at the end. There's no dumb questions. Feel free to ask whatever you want. We'll keep our discussion fairly brief, and hopefully leave lots of time for questions at the end. I have given this presentation in person before, or something similar to it. Obviously, it changed over the years. This is our first time doing Zoom. Usually I'm on the other end of the Zoom call, not the host, so my apologies if anything goes awry. So a little bit about myself. I've been a dentist. I graduated almost 10.5 years ago. After graduating from the University of Saskatchewan, I went and did a one-year pediatric general practice residency, which is not a specialty by any stretch of the imagination, but it's 1 year working in a children's hospital. I went up to Halifax. I enjoyed my time out there. And since June of 2011, I have been back in Regina at this clinic.
So hello, I'm Kelsey Butts, and I am a dental assistant. I graduated from the Sask Polytech, former SciAst, here in Regina in 2012. And I've been an assistant here at Regina Lakeview Dental since 2014.
So when we talk about careers in dentistry, like we said, I'm a dentist. Kelsey's a dental assistant. That's two parts of many. I do have a few listed here. So there are the dental specialties, which I will touch briefly on later. Those are further education after getting your dental school. General dentist, which is what I am. Dental assistant, which is Kelsey. Dental hygienist, dental therapist, denturist, and dental technician. There's also all the allied, there's a lot of connected industries and positions with the dental world, whether it's reception in dental office, sterilization techs in some offices. There are, salespeople and repair people. There are a lot of, dentistry is a big industry, but we'll kind of focus on these ones which have a little bit of training. Just to give you a brief overview, dental specialties, there are 8 of them recognized in Canada, I believe. I'll get to that later, but those are further education after becoming a general dentist. Dental assistant is typically a 1-year program offered in most provinces. Dental hygienist is either a 2- or 3-year program, depending on where you obtain your training. In Regina, currently it's a 3-year program. Dental therapy is no longer offered, and that's kind of a little bit of flux. Valuable part of a dental team, but the program is no longer being offered in Saskatchewan. There are similar programs offered in the States, but Saskatchewan had been training all the dental therapists in Canada, I believe, and the program's no longer offered. Denturist is a program that is not offered in Saskatchewan. It is offered in Alberta and BC, and that program is 2 to 3 years. And dental technician has some variability in the training. Some of it is on the job training. Some of it is you can take school before. And those individuals are the ones who make the dentures in the lab. They don't have any patient contact, or they make the crowns. So they're not patient forward. So if you're in a dental office, you may not have seen them. but they are a valuable part of the team of making sure that everything gets out to the patient as requested and as desired.
So as a dental assistant, you need to get a certificate. Now the education, like you said, there's 2 spots in Saskatchewan. So the main one is in Regina at the Sask Polytech. It's a 9-month course and your tuition is roughly around 11,000. That's including all your fees, books, clothing, and all that kind of stuff. The school offers a couple different ways that you can learn. So you learn in class study time. There's also a clinic at the Sask Polytech, and you'll go in there, and then you're also in dental offices just like ours. You come for practicums, and you get to learn with dentists, dental assistants, and all that. The second one is at the University of Saskatchewan in Saskatoon. That one is a 10-month course. And the tuition's a little higher, it's $18,500 with all the fees. But again, you're working with the future dentist students there. So you get to learn with your colleagues, future colleagues, and all that kind of stuff. And again, it's the same in class, clinic time, all that kind of stuff is pretty much the same for both of those. The requirements you need to have are your English A30, B30, biology, and either a math or a pre-calculus type of thing. Now, the U of S does have the same requirements. It's just they want you to add a chemistry science to that. And then you should have a level CPR-C requirement as well for it to become a dental assistant. So this is just a certificate program. Now, in order to become a registered dental assistant, you need to take a national board exam. So this board exam lets you work anywhere within Canada. Now you have to, some parts of Canada, you belong to an association, and as an association, you get to perform a certain list of duties. So you kind of want to see where you are in what you can do, part of it. So the exam for the national board is $625, and then each year, like I said, there's an association that you belong to, and you pay a license fee for that. So that's $225, and you're constantly learning. So you need to have 15 credits, and they're really easy to get. There's different things that they have of courses, so you're always constantly learning. They're free. Some are free, some you pay for.
We used to have conferences, so, you know, pre-COVID.
Yeah, pre-COVID. Now you're doing a lot of Zoom calls just like this, so it's fun. It gets to meet new things and see new things and all that. So yeah.
And as a dental assistant, the scope of things you can do when you graduate is different. You can continue to take extra courses to do things like an orthodontic module, some of the more detailed stuff with some of, you know, making crowns and that kind of stuff there. So you don't just take continuing education to fulfill your requirements for your 15 a year, but you can actually expand your abilities to do certain things in the dental office. So, you know, there's the continuing education you have to stay current, but there's continuing education that actually allows you to expand your scope and challenge yourself and offer different things within your, you know, to provide some variability in your day as well.
So as a dental assistant, you're very, very important in the role of the office, how it works. You can be a receptionist in the front, or you could be in the chair side in the back. So our basic duties are kind of like set up and disinfect, clean the rooms, the sterilization of the instruments, and then sit chair side with the dentist in all procedures. So you get a good balance of independence work, because you need to bring the patient back, kind of find out, problem solve, figure out what's wrong with them, determine what kind of x-rays your dentist might want, and then you get a good support sitting side by side with your dentist, doing the actual filling and assisting them, handing them all the instruments and all that. So it's a good balance, 50-50 of doing both of everything there.
Yeah, and no two dental assistants do the exact same job within this, you know, province, let alone within an office. Everyone's got their own areas that they're more interested in or better at, and you can find what interests or where areas interest you. Obviously, assisting a pediatric dentist who basically, you know, sees kids all day is very different from assisting a dentist whose practice is limited to root canals or something like that, or a general dentist for somewhere in between. So it definitely gives you the opportunity to kind of find the areas you enjoy and to find the areas you excel at. And like Kelsey said, it's dental assistant. A dental assistant has changed over the years, and that their scope has increased, and what they can do independently is a lot more too. So there is a lot of times where as a dental assistant, it's only you and the patient in that room working, and you do have the ability to do a lot of procedures under the direction of whether it's a dentist or the specialist. For a dentist, I'm going to talk specifically about education in Saskatchewan. The requirements to get into dental school do vary a little bit province to province and country to country. You know, University of Saskatchewan is one of the few schools where you don't need a degree before you get in. But everyone listening to this presentation has Google. So if you're more interested in leaving the province and going out to Ontario or Halifax or Australia or the States, you know, the requirements for each school are different, and the requirements do change year to year. The requirements to get into dental school in Saskatoon are different than when I got in. University of Saskatchewan is currently a 4-year program. It used to be a 5-year program that changed in 2000. I believe the graduating class of 2002 was the first one that was a 4-year program. Tuition works out to approximately $50,000 a year, 4 years. So that does not include your prerequisites, your 3 years before. But that's what you're looking at for tuition. That roughly includes equipment and books. Obviously no living expenses or anything like that. You do need now a minimum of 3 years of 30 credit years of university education with those prerequisites that are listed. The selection also includes a dental aptitude test, which has a few components. One is a science component, one is a soap carving, so manual dexterity, and then there's some essentially your ability to read quickly and retain the information section, and a section on your ability to kind of mentally manipulate objects, and so kind of your perception ability. And those classes have changed a little bit. Even I guess I applied to dental school in 2006 or 2005 for 2006. So it has changed a little bit in that time. So make sure you're checking. If you're in grade 12 right now and it's an application you're making in 3 years, don't take this presentation as what you necessarily need at that point. Life as a dental student. So assuming you've completed your prerequisites and you've been accepted to the dental student program, and I'm going to talk about pre-COVID times, because hopefully by the time anyone here is looking at getting into dental school, things will have changed a little bit. But it is a combination of classroom learning and hands-on learning right from the very first week. So obviously in your first week, they don't turn you loose with patients, but you do a lot of preclinical exercises. So when I was in first year, most of our morning was spent in classroom, learning a lot of our didactic stuff. And the afternoon was spent in preclinical, whether it was making dentures or practicing drilling teeth, or a little bit more of a hands-on componentry. You do start treating patients, the ones that aren't your classmates, in year 2, toward the end of year 2, and obviously right through year 3 and 4. There's a variety of places they currently treat the patients, obviously at the dental school, at the campus, at the U of S campus, and then they have some outreach clinics within Saskatoon. They just opened up one in Prince Albert. So the great thing about the University of Saskatchewan College of Dentistry is it does not offer any clinical specialty programs, meaning that the cool root canals to do aren't going to the specialists in root canals, because there is no specialty there. The cool, you're given so much more latitude in what you're able to do, that your hands-on experience relative to some of the other programs in Canada are quite significant. When I did my GPR program out in Halifax, I worked with a girl, there's 2 of us, and I worked with a girl that had her training in Quebec. And, there's a few things that I had done 20 of before, and she had done 3 of. Now, granted, in 2 days, I would do 20 of that same procedure in there, so 20, but it is a significant difference when you're, so that hands-on experience at the U of S was quite nice. Dental school is busy. It's a full-time job, and then you go home, have supper, and then you do your homework and studying, and come back to school to do lab work or reach out to patients for booking appointments. So I always looked at it as it was a full-time job, and then some. It wasn't just a few hours of class a week. It wasn't. There wasn't a whole lot of time for other. I didn't have a part-time job on the side or anything. If you make it through the 4 years. after graduation, you have options. What I did was a general practice residency. That's essentially an extra year of education in somewhat, it's a clinical education. I had to write a couple small papers and do a little bit of research, but for the most part, it was managing the on-call and then helping with running the pediatric outpatient clinic at the hospital. The programs are different all across the country. There's surgical ones, there's ones that are more community-based, there's ones that are more dealing with long-term care. UBC runs a lot out of their program, a lot of it's outreach into their remote communities. So there are some neat opportunities. A lot of people use a general practice residency to do before they go on to further their education in a specialty, and a lot just do it to kind of get a little more training in an area of interest, which was my rationale. And yeah, so private practice, which is what this is. So there's opportunities there. And further education. So I lied, there's actually 9 specialties, not 8, but they deal with this specific treatment. And oftentimes you're dealing with the more difficult cases in that area. So as a general dentist, you can do root canals, but some of the more difficult root canal procedures are done by the specialist. Same thing with, all of these procedures. There's nothing that, general dentists have the training to do some stuff, but some of the more difficult stuff, they just don't have that extra 2 to 6 years education. So that's better managed by the professionals in that respect. Things like oral pathology and oral radiology are true specialties that you're getting hospital privileges and that kind of stuff. Same thing with dental public health. That's kind of something you do. Most people who are dental public health aren't running also in a general practice clinic. They're usually working for whether it's governments or university institutions or something like that. Private practice, because that's where the majority end up. So that's kind of what we have experienced. So that's what we'll talk about. Hours, they vary significantly based on your location and where you want to work. If you're graduating dental school in Saskatoon and want to stay in Saskatoon, unless you have a great opportunity or a personal connection, there's not a real big chance of you getting a Monday to Friday 9 to 5, as you would see. Most clinics are open at least an evening, if not more, a week, and many now are open Saturdays. There's even a dental clinic in Regina that's open on Sundays. Some of the more rural areas still have the more typical Monday to Friday days, or maybe your Monday to Thursday, but a lot of people who are starting out and working in some of the larger centers are working at 2 or 3 different offices to try and get enough hours in. And by hours, it's patients. If you're not seeing patients, you're not getting paid. So, in order to have enough sufficient patient flow, a lot of people are working, evenings one place and during the day a little bit somewhere else and picking up a couple weekend shifts somewhere else. Types of practice. So there's an associateship in which someone else owns the practice and all the assets within, the chairs and all that kind of stuff. And they worry about staff and, making sure that that's all provided. And you worry about doing dentistry, which is the typical approach that people take to start. There are also opportunities to buy into a practice and become an owner of such, and the extra responsibility that comes with that, or starting a new practice, which obviously there's costs and time associated with that. Some people still make that leap right away. I'd say it's more infrequent, but just when you look at the debt levels, but it is an option. So dentistry as a whole, and I think we could paint this as to whether it's being the dentist, being the dental assistant for most of these, the dental hygienist, the specialist, we share a lot of these same issues, good and bad. So when I look at pros of the profession as a whole, and maybe more specifically tie into dentistry, but the patients. The day would be pretty boring if there weren't patients, and for the most part, they're all appreciative of you being here, helping them out. Lots of times patients are coming in pain or discomfort, or they just don't know, and that's the trust they place in you as a team of professionals to help make things right for them. And almost all patients you leave with a positive experience. It is nice having that professional trust, and that is not just the dentist. It is amazing how many times you'll recommend something to the patient and have a 10-minute discussion with them. And you walk out of the office or walk out of the room, and the dental assistant and the patient are left sitting there, and the patient turns to the dental assistant and goes, well, what do you recommend? Or what would you do? Or is he right? So I think all of us, as we get more experience, can have that conversation and understand. And patients, I'm not a mechanic. I don't know much about my car. So if I got an issue and I take it in, I trust the person on the other end. Same thing, I trust my medical doctor to provide proper, assessment for me. And I think we all as a society have to defer a little bit to the experts and have that trust. And that takes time to build that. But it is nice knowing that patients actually rely on your expertise, not just your ability to provide the treatment, but your ability to help them make the proper decision for them and give them all the options. Days aren't boring. I've yet to have a carbon copy of 2 days. We often joke that we have a morning meeting, usually if whoever working with that day, and kind of talk about what's expected that day. That's not usually what happens. Usually there's some variability, especially now. There'd be patients, canceling with COVID contact and have to cancel anything like that. But if someone thinks they've got a broken front tooth and need a filling, well, it's actually a back tooth that needs an extraction. And so the variability in the day is nice. As much as we'd love to have sometimes a cookie cutter day, it's that might get a little bit boring after a while. So it's nice to have that variability and the challenges throughout the day that you look at and go, I need to learn more about that, or I need more practice in that. Working with a team is nice. Dentistry, you spend all day worrying about fractions of millimeters, and it's nice to have a group of people around that can kind of share and understand the difficulties and discuss the problems with, whether that's you and your dental assistant were in the room, or you and another dentist, or you and the front staff talking about how to book someone or something like that. The dental offices that are one dentist and one assistant and one hygienist and one receptionist, there's not many of those left, because that's tough from a financial standpoint, but it's also tough from, it's nice to have that ability to work as a group and problem solve together. And as isolated as those little tiny rooms are, you're doing dentistry are, that the team as a whole can help kind of provide some insight. And compensation. As all professionals, and I'll speak more to dentistry here than some of the other ones, but I think anyone with a university level education, which comes from a regulated profession, the compensation is good. I had one colleague tell me once that, if you run a good dental practice and manage your debt, you will be in the solid middle class. Any type of medical professional, if you're looking at that as a get-rich-quick scheme, you're kind of out of luck. I think a few slides back, you saw that you're looking at the average debt load graduating out of dental school is $250,000 to $300,000 now. That takes a while to dig out of, and that doesn't include maybe having a house or a vehicle to get to and from work. But it's not something that you're barely scraping by if you manage correctly. But there are risks in terms of if you're starting your own practice or anything like that too. So I always think it's a nice way that if everything's run efficiently, you should be in that solid middle class. So we talk about cons of profession, and for anyone that's really paying attention, you'll notice it's the exact same thing. The patients, most of them are great, and most of them are great all the time. But unfortunately, we're dealing a lot with pain. We're dealing a lot with high expectations. And this is not a publicly funded system for most of the patients. So they're paying money to have the service provided. And all of that comes with expectations. And the amount of times Kelsey and I have heard, I don't like the dentist. Don't take this personal. I hate all dentists. I hate all dental people, whatever it is. You take it with a grain of salt, but I'm sure it'd be nice if everyone came in and said, oh, there's no place I'd rather be than the dental office. But it's all about communication. I sit on our essentially complaints review board with the College of Dental Surgeons here, so that we regulate the dentists of Saskatchewan. And communication is a huge thing that results in breakdown. So you won't get along swimmingly with every patient that comes in the door, but it is a matter of treating them with respect and understanding that no matter what you do, no matter how great of a job you do for someone, some people just you're not going to make happy. And that wears on a person a little bit, but it's just part of dealing with the public. And I'm sure that you could ask your teachers, they'd say the same thing. Pros, great kids. Cons, sometimes the kids aren't so great. And I think any job where you're forward facing and dealing with members of the public, that's a given. So there are careers within dentistry where you're maybe not dealing with the public as much, and that's where you look at denture technicians. some salespeople, some research. There are options there. So if you think, oh, field sounds awesome, I'm super interested, I love working with my hands, but I don't want to deal with people. You know, something that's in a laboratory or something like that, or research may be, you know, something that you could look into. Professional trust. Obviously, if patients are kind of putting a lot of weight in your comments and your beliefs, whether you're the dentist, a dental assistant, or another dental professional, that comes with some responsibility. And, you know, this isn't 50 years ago where you just told the patient what was best and they did it. Nowadays, it's a lot of discussion and the patient has that autonomy to make a decision. So it's helping them have all the information and helping them understand the risks and benefits of each of those treatment choices. But unfortunately, we don't, you know, there's not much that's guaranteed when we're dealing with biology. There's some things that look awful and they work, and there's some things that look beautiful and they don't work. And, you know, patients say, well, why'd that fail? What'd you do wrong? Unfortunately, sometimes that's just the nature of biology, and you know, that once again, finances play a role in that. People have paid and have certain expectations, so it's important to have that discussion. But it does come with some responsibility. The no 2 days ever being the same, yep, that's great. But you know, if you like that variability, but at the same time, you know, you can't just be on cruise control, come in for the day and kind of glide through it. There are a lot of different things going on. Especially about 3 o'clock on Friday afternoon when the phone starts ringing a little bit more. So you got to be adaptable, and it also means you and the entire team have to be adaptable and understand that, you know, you can't be here all night, every night dealing with emergencies, that you do have to have appropriate kind of understanding, especially of those that are answering the phones and that kind of stuff. So I talked to one dentist one time, and he said his first instructions to his receptionist were, if you can't figure out the best time for them to be seen and I have to talk to them, they're getting seen today, because I'm never going to say no to anyone. So, you know, it's a matter of having appropriate setups and stuff so that you don't burn through staff, because at 5 o'clock every Friday, you're just booking in a couple more patients and they were expected to be home at 4:30. Working with a team. It's a pro and it's a con. If all you ever had to do was worry about yourself, I think we all realize in a classroom or a team, a sports team or a choir, a rec club or whatever type of work you do, there's days that, you know, everyone gets along swimmingly, and there's days that something's a little bit awry, and, you know, maybe someone didn't do something they're supposed to do and it kind of had a trickle down effect. And, you know, speaking from the dentist standpoint, oftentimes you're viewed as or are the leader of a team. And you got to help manage and make sure that everyone kind of understands their responsibilities and understand how that has an effect on everyone else. And I think, as I could speak for Kelsey as a dental assistant, that you know, working as part of a team and maybe having the dentist, you know, be the leader of that team and getting him or her that appropriate information is sometimes easier said than done too. So. And if you are the practice owner as a dentist or a dental specialist, there's a lot of things you're not taught in dental school that you're expected to know on day one. And you got to either have the appropriate individuals around you or have some good leadership and guidance on things like payroll, taxes, hiring, firing. Because when I talked about compensation, if you do those things wrong, you're not going to have your doors open for very long. So I did mention there that, yeah, when patients come in and pay their bill, it's not cheap. And I think what the general population maybe doesn't understand is how much of that is going to pay the bills, you know, the rest of the staff, the building overhead, all our supplies. You know, you're looking at upwards of up to 80% of that bill you're paying is just purely to pay off some of the expenses. And that doesn't include, you know, like I said, paying off dental school or anything like that. So there is a high barrier to entry from a financial standpoint. So the cons are very much the same as the pros. A lot of it is how you look at it and how you're able to, you know, swing it to your benefit or your detriment. Why I chose this career and why I still love my job. And I don't know if Kelsey put a slide in about her, so she can fill in hers after too, but control. I have a young family, and even when I didn't, I have the ability to kind of look at what, in the situation I'm in here, to look at what hours I'll work. And, you know, dentistry as a whole has a billion procedures, and there's certain ones that I am comfortable doing and like to do well. and like to spend most of my time at. And so you can kind of, in a group practice like this, where we have 5 dentists, you can kind of, pick and choose a little bit and find people with strengths and weaknesses that vary from your own. But, it's not a problem. I knew far enough in advance for this presentation to have this available, and, a little bit of flexibility. We are expected to cover call. And be available for our patients to help discern if something is an emergency and needs to be seen or not. Once again, a group practice environment allows us to kind of spread that responsibility around. And, if anyone can ever take a holiday again or be gone for a week, you got other people to cover for you. You're not worrying the whole time about your cell phone ringing. The continuing education, Kelsey touched on that a little bit, but we obviously have continuing education too. As dentists, we need to have 30. We're going to have 90 credits over 3 years. There's so much available. I can do 90 credits in only one area of interest, but it really does allow you to kind of focus the areas that you're interested in or that your patients are interested in. And, I got 28 classmates and we all practice dentistry a little bit differently, even though we all went through the same dental school. And the patients. I mentioned in the cons that people are a little bit of a tough time, but I don't think I'd want to have a job. There's certain days where I'd like to have a job where I didn't see people, but most days I couldn't imagine going to work every day and not having interaction with people, both staff and patients who, in this case are coming in. The reason you do that education is so you can try and help people out and provide some level of expertise. And obviously on the concept of people is the dental team. Same thing, I would struggle to, sit in a room by myself and do dentistry with just the patient. You want to have that person that you can, discuss the treatment with after, have someone that can point out if you're doing something wrong or you missed something, or, that person sitting beside you helping you out. And same thing when you're reviewing x-rays with another dentist after. There's a reason I got involved in kind of organized dentistry, and being involved in our college or our regulator is, it's another way to kind of connect with another group of like-minded professionals. So Kelsey, what do you love about your job? Or what do you wish you could change? Both.
Well, I really like dealing with the public and the patients. I like the science portion of it and the problem solving, just everything. I always wanted to do something that puts a smile on people's faces, and I can do that. I did the continuing education so that I can put braces on people's teeth too. So I'm right in that room. I get to see the change from this way to this way, and I like it. It's a good balance of everything you get to do. I get to go from room to room to room and see everything. So that's what I like about dental assisting.
And for those that are thinking about being interested, and maybe there's some drawbacks, what are the drawbacks or the things you have to learn to deal with?
I don't know. It's honestly, like he said, no 2 days are ever the same. So you have to be able to adapt, and you can be like, oh, on the spot, we're doing a filling right now. Even though it's Friday at 3 o'clock, oh, we're doing an extraction. All right, I had plans tonight, but guess what? We're going to stay and we're going to do this because patients come first. So, yeah.
Okay, that takes us to our final slide on questions. So I think I'll stop sharing my screen here. And the only chat thing I see on here is regarding schools. So does anyone have any questions? I don't know if Renette has control over muting everyone or watching questions on there. I'll maybe pass that back to her to lead from here in.
Yeah, well, thank you so much. That was a very informative presentation. We do have a couple of questions from the office, I think, and maybe we'll give the student an opportunity to maybe consider asking something too that may have not been addressed. Mind you, like I said, you covered things very, very well. Thank you very much. One question about going from dental assisting to dental hygienist. Is that a transition that you can make, or is that a separate course for students to consider?
It's a transition you can make. You still go back into the beginning of dental hygiene school. My understanding, and do not quote me on this, is there are some courses you do not need to retake that you're given credit for, I think within a certain period of time, and depending on if it's at the same school. But that is I'd say a fairly common career pathway, and some graduate dental assisting and go immediately into dental hygiene. Some work as a dental assistant for a few years and choose that path.
It's good to have dental assisting, because dental assisting will kind of show you and tell you how the office is run. As a dental hygienist, you really only do one thing. So you're very adaptable, that you can assist, you can do this. So
it's nice. Dental assisting gives you a little more, especially experience in the office, gives you a little more I guess training in all aspects of dentistry. And whereas dental hygienist is very well trained in kind of a section of dentistry. Having both is fantastic, and it is pretty common that a lot of the dental hygienists have dental assisting training before and some work experience.
Yeah, thank you. There is a question from our student. Any tips on undergrad and the DAT?
Obviously, tips on undergrad: cover your, make sure you cover your prerequisites. When I went through school, it was only a 2-year requirement, and that was kind of what I wanted to do, was 2 years and get in. Now it's 3. So I know the strategy on how you're spacing out your classes and all that has been a little bit different. Everyone always talks about, well, what's your backup plan? And that's a decision you have to look at. When I went through, not saying this is right, but I didn't have a backup plan. It was get into dental school. And if that meant 2, 3, or 4 years, I'd obviously work towards a degree in that standpoint, but I, kind of have your plan. And if that includes a backup plan laid out. The DAT, there are DAT prep courses that you can take that were invaluable for me. You can order some study materials, you can get some extra soaps to practice carving. Have a look, because if you're applying to more dental schools than just the U of S, certain dental schools don't take into account certain aspects of the DAT, and certain dental schools do. So focus on, of those 4 areas, the ones that matter. You still have to do all 4 sections, but it doesn't matter at certain dental schools on what happens in certain areas. So look for a DAT prep course, usually be offered by some of the 1st or 2nd year dental students at, you may have to drive up to Saskatchewan if you're going to school in Regina. I know they used to offer them here a little bit too. So trying to learn how to do that stuff by yourself is tough. So learn from someone who has been through it and made it through before.
As a former career counselor, I know students, that's the one question that they always ask when it comes to that DAT or to the MCAT or the LSAT. All of those admission tests really kind of make students nervous. So, so thank you for addressing that for this student. Any other question? I think we may have.
Yeah, Kelsey, when you do this, the further training, is it a requirement of your association that you have to do that continuous learning? And is there a financial benefit to being trained in an additional procedure that you can do? Do you make a little bit more money? It makes you more marketable? How does that work?
It does. So most of the courses that you can take, there are free courses online. You can do stuff that you can, like I did with the ortho, so you can train to put braces on. That does make you more marketable, because you're now an asset to the clinic. The dentist doesn't have to be in that room. You could be in that room doing this, and they could be in the next room doing fillings or an extraction, another procedure over there. So it's very marketable there. And yeah, you have there's lots and lots of websites, free things. Your association puts on conferences all the time. Some of them you don't have to pay for. I'm doing one next week, and it's all about saliva. So you kind of just get to learn and see it all. So,
So just wage-wise, a dental hygienist, a dental assistant, what's kind of a range that each of those ones would?
The Dental Assisting Association puts out a suggested, I guess, salary schedule every year. And obviously every office is a little bit different in terms of, do they offer sick pay? Do they offer vacation? Vacation pay is included, but what type of benefits are there for uniforms or health spending accounts or, a benefits plan? But their kind of recommendation for a first year dental assisting student is 23 or 2350, I think, kind of everything rolled in. And it varies a little bit each year depending on, you know, demand and that kind of stuff. A hygienist, they don't put out anything, but I think you'd be looking at Emily and variation from office to office, and province to province, but likely for starting somewhere around 35. So obviously with 3 extra years education, there's a higher starting point. And I can't speak to therapists. Most therapists are, because they work independently and do, for those who don't understand what a dental therapist does, they do a lot of fillings, a lot of work on children, and they do some extractions on baby teeth, but a lot of work in doing fillings and that kind of stuff. So they're basically paid per procedure. And there are some dental hygienists that are paid the same way. They're paid a percentage of their procedure, but and then in dentistry, obviously a huge variation, but I think you could look at probably your average starting hour, if you tried to calculate it hourly, is probably in that $50 to $70 around there. Now, under the thought that that's if you're busy. If you're spending a lot of your day, as one friend of mine says, watching Netflix, you know, waiting for people to come in the door, obviously you're not, because just like a dental therapist, you're kind of paid for what you do. So a lot of it depends on where you're at. But that would be kind of a rough, you know, estimate. And, you know, obviously you're going to be busier in a rural area that's underserviced than you are in an oversaturated urban area, but you just want to be there. So that's something you kind of have to look at.
So when you came out of school, you started with Lakeview Dental, and then you have an opportunity to buy into the clinic and become a partner kind of thing. Is that the way it works?
I'm actually an associate. I don't have buy-in here. But that's typically, if you want to kind of look at, those who are interested in buying in, you know, for the most part, you're starting as an associate and then buying in or buying out, depending on the age and desires of those that you were working for. That's kind of the general flow. That's changed a little bit over time, even since I graduated. There's a big corporate footprint in terms of corporate ownership of practices. And then everyone in the practice is an associate and manages the patient files and stuff from a legality standpoint, but don't actually own the hard assets. So whether that's the dental chairs, you know, the computers in the office, the X-ray units, all that can be owned by anyone. Whereas no one owns patient files, but those who are in charge of kind of managing them and making sure that patients are well taken care of has to lie with a dentist.
And a question about the job prospects, you know, moving forward. I know that back in the day, and I haven't checked my stats lately, but I know there were like 25 spots for a dentist to be accepted into the University of Saskatchewan program. Is that still the number? What are the prospects for students considering this as a potential career? And likewise with dental assisting and dental hygienist, are the job prospects fairly good right now?
Dental assisting, there's about 80 people looking for dental assistants right now in the province. So yes, if you can graduate as a dental assistant, there's definitely work for you. There is no class this year at Sask Polytechnic, which is 60 students typically. So the University of Saskatchewan actually increased their enrollment from 30 to 40 in the dental assisting program. There's no intake due to COVID issues and with their clinic and stuff. Not that there's no break or anything, but just from a safety of delivering the program until they can maybe make some renovations there. So as a dental assistant and a dental hygienist, there's lots of jobs available. As a dentist, the number now graduating every year is around 34. Obviously depends if everyone passes through the 4-year program, of which I believe 25 are Saskatchewan students. That may have dropped a little bit, but give or take. And they do also do a what they call a qualifying program. So a foreign trained dentist. There's a few ways into Canada, but one is to take the last 2 years of dental school if you have to pass the appropriate exams and stuff and you're able to take that. So the University of Saskatchewan offers that as part of their graduating class, as well as some foreign trained dentists who then take the last 2 years. So is the job market saturated for dentists in Saskatchewan? No, but it's still very different from when I graduated 11 years ago in terms of the opportunities that are available. And like I alluded to, if you're looking for Monday to Friday, 9 to 5, probably not finding it. And even now in some of the rural areas, it's a little bit tougher, but definitely the job prospects in terms of being busy are as a generalization, better in the rural areas than the urban. But in saying that, there's certain rural areas where you're not going to be as busy, and there's certain urban areas where if you find the right opportunity, would be busy. So.
Perfect. Thank you.
That helps a lot.
Yeah.
Thank you. This was a great presentation, guys. Thank you very, very much.
Well, thank you for having us. Appreciate it. And, enjoy your day.
You too. You too. Have a great day.
Take care.